My name is Natalie Kimball, and I am the author of An Open Secret: The History of Unwanted Pregnancy and Abortion in Modern Bolivia. Abortion is one of the most common experiences in the world, yet because of societal stigma and shame, few people talk about their own abortions. This can be particularly true in countries where abortion is restricted or outright criminalized, since talking about an abortion could open you up to legal repercussions. Abortion's criminalization, however, doesn't prevent people from seeking them. Actually, rates of abortion are often higher in places where the procedure is criminalized. When people need an abortion in a country where it is illegal, they often have trouble finding providers who perform the procedure safely, and they end up suffering medical complications or even death due to poorly performed procedures. Even where abortion is legal, such as in the United States, there are often so many legal restrictions against it that abortion can be difficult to access. My book uses oral history to highlight women's personal experiences with abortion, as well as with unwanted pregnancy, in the South American Andean nation of Bolivia. The book focuses on two of the largest cities in the country, La Paz and El Alto, and it covers about the second half of the 20th century. To write An Open Secret, I interviewed 58 women about their personal experiences with unwanted pregnancy and abortion. I also interviewed doctors and healthcare workers who performed abortions, and also government officials, police officers, and activists on both sides of the debate over abortion's legalization. In addition to the oral interviews, the book draws on medical records to show people's experiences seeking care after abortion at hospitals in both La Paz and El Alto. Bolivia is a really interesting place to investigate women's personal experiences with unwanted pregnancy and abortion. Bolivia's population is very diverse. There are people of European descent and also of so-called mixed race, who are called mestizos, but also very large populations of indigenous people who speak Quechua, Aymara, and other indigenous languages. These different groups use different forms of healthcare. While some visit Western clinics and hospitals, others recur to Andean midwives and traditional medical practitioners. Activists in Bolivia also tend to think differently about topics like abortion and reproductive rights depending on their own ethnicity and background. While women's rights activists often say that each person has the individual right to decide whether to have a pregnancy or to have an abortion, indigenous activists often argue that reproductive decisions involve the rights of the entire indigenous community, not just an individual person. So key to this conflict are distinctions between liberal Western notions of rights and communal notions of rights that are often practiced by indigenous groups. My book finds, however, that this language of choice and rights, which is often used in debates about abortion's legal status, doesn't match up with how people talk about their own abortions. Most of the people I interviewed in Bolivia of any ethnic background said that they had been obligated or forced to have abortions. They said that this was the case due to a variety of things, like life circumstances, economic strife, or unsupportive family members and partners. Few people of any ethnicity claimed that they had chosen to end their pregnancies. This is not a new finding, nor is it a finding limited to Bolivia. Activists and scholars in reproductive justice movements worldwide have long argued that there are a range of inequalities that shape and constrain people's choices with respect to their pregnancies. These inequalities include racism, class discrimination, economic instability, homophobia, and poor relationships between medical providers and patients. If you're interested in learning more about individuals' personal experiences with unwanted pregnancy and abortion, I encourage you to check out my book. Thank you.